Good morning. My name is Dr. Angelina Riscala. Welcome to my podcast. Today we are reviewing the case of patient X, a 72-year-old male with no prior health conditions. A 72-year-old with no health conditions is quite amazing, which is why this case is especially bittersweet. Patient X presented with the following symptoms: abdominal pain, fever, hematuria, which is blood in the urine, and nausea. Due to the patient's age and history, his GP suspected kidney stones, which can be caused by dehydration, and sent him for an abdominal CT scan. Because CT scans are cheaper and less time-consuming than MRIs, they are used more often, especially in cases where doctors aren't completely sure that there's a serious health issue. Unlike MRIs, CT scans also pose no risk for those with aneurysms, pacemakers, cochlear implants, tattoos, metal in the body, whether it be suspected or not, and those that use oxygen tanks. CT scans are also more compatible with people who cannot stay still for long periods of time and or are affected by loud noises in tight spaces. This may include children, the elderly, those with anxiety, those who are claustrophobic, those with disabilities, and finally, those who are obese, as most MRI machines have a weight limit of 350 pounds versus that of a CT machine, which is 450 pounds. Because of how quickly a CT scan can be performed, they are often used in emergent trauma and non-trauma situations, where things like bleeds in the brain and internal organs, blood clots, and fractures need to be diagnosed swiftly in order to save lives. CT scans are extremely important to the health of Canadians. Approximately 5.41 million CT scans are performed in Canada yearly. They are mostly used to diagnose tumors, bone abnormalities, joint abnormalities, infections, and blood clots. However, when used with contrast mediums, structures like blood vessels and intestines can indicate abnormalities as well. In many cases, CT scans that are used in cases of emergencies are crucial because it is very easy for doctors to miss fatal injuries and diseases without proper imaging. Full-body CT scans are also very important in trauma cases like car accidents where there may be multiple injuries that even the patient can identify due to shock or pain in other affected areas. The CT scan works by taking X-ray images of your whole body and putting them together to create a 3D or 2D image of your organ systems, which are composed of soft tissue, bones, and blood vessels. When X-rays are sent through your body, dense materials like bones and tumors absorb the rays and appear white on the CT scan. Less dense materials like soft tissue and fluids let the rays pass through them, which is why they appear darker in images. Sometimes contrast materials injected into the veins or ingested are used by doctors to identify certain things that are too dark to see normally on the CT scan. This is why the radiologist was able to confirm a tumor in patient X's spleen and several enlarged lymph nodes. This indicates cancer that has metastasized to different parts of the body. The CT scan gave patient X 3 more months than he would have without a diagnosis or treatment. For patients with less progressed disease, this could be life-saving or greatly improve quality of life. The type of cancer that most commonly spreads to the spleen and lymph nodes is leukemia. The only way to confirm leukemia is through a blood or bone marrow sample examined under a microscope. A pathologist was able to confirm leukemia through patient X's blood sample. This is what it looked like under the microscope. The pathologist was able to see this with the help of a microscope that uses properties of light to magnify whatever is placed in a slide, like a biopsy or sample. A microscope contains 2 convex lenses. Light is reflected up from the specimen and into the first convex lens, which is called the objective lens. This produces the first image, which is real. The reason we use a second lens is because the first image isn't magnified enough and will need to be much bigger in order to see things on a cellular level. Light that passes through a convex lens refracts inwards towards the focal point. Light that passes through the edges of the lens will bend to meet this focal point. Light that passes through the center will remain straight to meet this focal point. The second lens, which is called the ocular lens, will act as a magnifying glass for the real image. Because it is a convex lens, it'll bend light towards the eye, making this new virtual image appear much larger than the specimen. Microscopes are also life-saving tools in medicine. They are the only way to diagnose diseases that occur on a cellular level. Without the use of microscopes, we wouldn't even know what cancer is. Without microscopes, we really wouldn't be able to understand how the body functions, and we probably wouldn't even have cell theory. Microscopes have helped scientists, doctors, and veterinarians improve the efficiency of healthcare and save lives. Most of what we know about the body has been through analysis like touch, smell, and sight. Microscopes have helped us see further than our eyes and analyze things in the purest form, cells. This doesn't only apply to humans, though. All living organisms use microscopes. Diseases in living things would be rampant without the invention and use of microscopes. After finding leukemia in the patient's blood, doctors were able to link his diagnosis to benzene gas exposure. Patient X was an auto repairman from ages 19 to 65 and was exposed to benzene fumes emitted from cars and pure gasoline. Benzene is a chemical product created by mixing carbon and hydrogen. Its chemical formula is C6H6. Benzene is a carcinogen, which means it causes cancer. It is spread through its vapor because it evaporates very quickly. Benzene is formed naturally, but is especially dangerous when produced in high volumes through human activity. Benzene exposure is damaging to cells. In severe cases, it can cause anemia, leukemia, and a compromised immune system. Benzene was also found to affect chromosomes in bone marrow and shrink ovaries. The DHHS has concluded that benzene causes cancer, specifically leukemia, in humans after long exposure, lasting over a year. Benzene is most commonly found in gasoline, tobacco smoke, and car emission. Less harmful amounts can also be found in glue, cleaning products, and art supplies. If you suspect benzene poisoning and have any of the following symptoms, please consult your physician as soon as possible. Drowsiness, dizziness, rapid or irregular heartbeat, headaches, tremors, confusion, and unconsciousness. Not only is benzene harmful to humans, it is also harmful to animals in the environment. Benzene can also cause similar problems in animals like low birth weight and bone marrow damage. They can be exposed to benzene through contaminated soil, water, and air. Because of how quickly benzene evaporates, it is easily transported through air in long distances and can settle on soil or in water. Benzene in soil causes disruptions in plant growth and even plant death. Benzene in water may change behavior and appearance in aquatic species and can even affect their reproduction. An estimated 360,000 Canadian workers have been exposed to high levels of benzene, and approximately 40% of them will develop a blood disorder because of it. Let Patient X be an example to always wear protective equipment when working in hazardous environments, and to constantly self-check and be aware of changes in your body. Just because you feel healthy doesn't mean you are. Take care of yourselves and have an awesome Monday.